All right, everybody, like she said, I'm Dr. Martin Hart out here at the Biologix Center. And today we'll be a little more philosophical, which I always love to wax and wane, a little philosophizing. So we're going to cover the 4 quadrants of healing, being truly holistic. All right, if you flip slides for me. So our to-do list today, our agenda, I want to cover kind of some definitions of holistic medicine. And then I want to move from holistic medicine to understanding of the 4 quadrants. And then I'll go through each of the 4 quadrants, and I'll talk about how to apply assessment and maybe some treatment ideas on each quadrant as we go along. All right, so how do some organizations, different professional groups or different clinics, how do they define holistic medicine? Well, one definition is the art and science of healing that addresses the whole person. I think that's a really good definition of holistic medicine. It makes sense, right? But what we leave out is, what does it mean for the whole person? What are we really addressing here? And so a good starting point is mind, body, and spirit. But really, this still leaves out other ways that we experience life. It still leaves out other realms. And so another addition is this really got a foothold in psychology and social work, is the biopsychosocial model, right? So that's where it encompasses our biology, our psychology, and then the social aspects. Again, that's maybe a little fuller, although it might leave out a little bit of the spiritual aspect, but we're still missing something. And this really hit me at some point that we're missing it. And so that's what we'll cover in just a second. But we can address the whole body, and that's fantastic. But we need to address the whole person. And so even if we say I'm addressing the whole body, we're still less holistic at that point than the mind, body, and spirit. So let's look at the next slide. So if you're going to work with a mind, body, and spirit, what does that mean to you if you're a practitioner, if you're the patient showing up and somebody says, I'm going to work with your mind, body, and spirit? Do you really know what they're conjuring up? Do you know, okay, are they going to give me some positive thinking? Are they going to do tarot cards? You know, what does that mean? Are they going to, maybe when they address the body holistically, maybe it's somebody who's doing typical traditional medicine and they talk about diet a little bit. But is that really holistic at that point? You know, are we still missing parts and pieces? Is this just putting it together? In my opinion, that is what's happening with many people who call themselves holistic, or even some patients who are looking for holistic medicine. They don't really know what they're looking for. And so if we look at the next slide, we'll cover a little more of that. So it's really interesting to look up, like if I'm trying to help my patients find a practitioner, maybe there's not a good biological medicine practitioner in their area, so I'm trying to help them find someone. It gets really muddled when I say, okay, we use holistic health, but all that means is we use some supplements, or we use some positive thinking and we talk about goals. Well, for me, holistic medicine really started to shift when I started reading the works of Ken Wilber, an American philosopher. We'll flip to the next slide. I probably got introduced to Ken maybe 10 years ago. But his philosophy is so vast and comprehensive. It forms a really beautiful theory of everything, okay, in a way much different than even physicists say we're trying to encompass a theory of everything. He includes physics in there, but also psychology and biology and neurology and looking at different spiritual, religious aspects of life and cosmology. And so it really starts to integrate it. So he calls that his integral theory because it's truly integrated. Well, one of the great ways they organize his integral theory is what he calls the 4 quadrants, okay? And the 4 quadrants, they're really a great tool to understand your experience in the life, right? Life's experience living through you. So I'll show you the 4 quadrants here right now on this next slide. So in the upper right quadrant, we have the I, or our subjective field, and I'll cover each one of these in depth. Then we have the upper left, which is the it, or our objective, our physical manifestation of personal one. And then as we go down, these stop being individual elements of our experience, they become group elements. So we have the bottom right, which is intersubjective, or our we, or relationships. And then the bottom left, we have the it's, or they're interobjective, kind of physical reality or reality around us. So let's dive into each one of these. So that I, or subjective, you know, when I explain this to patients, these are the things that you can only tell me. I can't figure out by looking at you or examining you. Maybe I can get an idea, but I don't really know until you tell me. So it's our inner world of thoughts, feelings, memories, and personal experiences. It layers in personal, psychological, and emotional development. So different practitioners talk about ego development or childhood development, childhood psychological development, psychodynamics. That all comes through these layers. Different worlds of different religions, like Christianity, has certain levels of spiritual development where they talk about the purgative, illuminative, and theosis levels of development. All of that is included in this intersubjective, right? So in holistic medicine, this might be addressed by looking at potentially therapeutic counseling, life coaching, looking at your values and goals, processing your emotional issues, or doing some trauma work, right? Getting comprehensive into any issue that might be affecting your health and healing that would be addressed in this realm. Let's look at the way we can assess that. So case history is going to be a huge one. Getting to know the patient and the patient, sharing your story with them, your background, detailed interviewing. You can do questionnaires like the ACEs score, adverse childhood experiences. You can look at things like depression and anxiety scores. You can just observe. How does the person across from you act? How is that patient interacting with you? How are they? Are they fidgeting? Are they calm? Are they relaxed? Are they very agitated? Sometimes you can see that somebody's wearing maybe a religious necklace or whatever. And so you can know, okay, maybe the spiritual is very important in their life. And then vice versa, as a patient or as a client, what are you presenting? How are you presenting your internal world? Another one is you might have, as a patient, you might have a counselor you're using, or you might keep a counselor in your office as a practitioner. It can be very helpful, or even maybe a chaplain or someone like that. Other ways are different energy psychology techniques. So for instance, I'm trained in neuroemotional technique, and that gives us some kinesiological methods to assess someone's emotional world, their neuroemotional complexes, what they're called in that technique. Let's look at the next quadrant. So this is it's the upper left quadrant. So this is the body's physiology. It's our neurology. These are all the things that can be studied and measured. Pretty typical in Western medicine that this is what we focus on, right? But it also includes the subtle energy systems of the body. Some of these can be measured. So for instance, we can measure acupuncture meridians looking at skin galvanic resistance, the amount of electricity drawn into the different acupuncture points, other subtle energy systems like that. It's your physical structure and function. So of course, I don't operate from the idea that the body is a machine, but I use that picture because it gives you an idea. This is something that you can look at and can be measured, dissected, whatever. Okay, so that's our upper left quadrant. So let's look at some ways we can assess that. Again, a great case history is going to be helpful. It gives you some clues. So we have traditional methods, the typical imaging and blood tests and all of those sorts of things, ultrasound, x-rays, all those are going to fall into this quadrant. And I put CAM being complementary alternative methods. So for instance, Chinese medicine, they have different palpation techniques and tongue diagnosis and pulse diagnosis. Those all use the same quadrant. They all use the body, right? Biofeedback is another one. So there's different variations of biofeedback machines. Some Rife machines have biofeedback. Also, things like kinesiology or manual muscle testing can be biofeedback. Frequency-based assessments, where they use a computer-generated system to put in a certain frequency and then read it back out. That's other ones. And just good pattern recognition. So as patients, you want to be paying attention to what are some of the patterns in your life. I get sick every time I eat X, Y, and Z. Or every time I go out into this type of weather, it affects me here. And then as a practitioner, it's highly important you see these patterns. It's very often that sometimes a patient will bring me in some labs, right? So we're still sticking to this traditional method of examination, and it mostly looks normal. But when you start looking at patterns, okay, I had this with another patient recently, the way their red blood cells looked compared to their hemoglobin, compared to their iron, compared to some of their B vitamin markers, what it told me is they were really suffering from anemia. But you wouldn't put that together just by looking at those things individually. You might say, oh, it looks fine. Maybe you're a little low, but it's okay. But when you start to look at that in conjunction with their case history, you say, wow, you're anemic, and it's probably coming from a chronic infection. Okay, and so we really have to look for those patterns. Let's look at quadrant 3. This is called the we, or the interpersonal. That's that bottom left quadrant. These are our relationships, right? These are our culture, our society, the institutions we're in. So what is really interesting is how often we miss how much our relationships affect us, or the culture that we're in from our friends or our work environment, right? Or even our society. Many people know right now that all the stress that's going on in our society right now, Western world, and the global world as well, but in America in particular, being here, I can really account for this. It's stressful right now. And so that's affecting people's health. Okay. So that stress from our societal stress and cultural stress right now, it is creating issues, health issues for people. This is heavily overlooked. Okay. Doctors and practitioners, we have to know the signs related to relational stress and potentially cultural, societal stress, and be ready with resources for patients. It's very, very common that I have patients that maybe their marriages or their intimate relationships are creating massive amounts of stress in their life, leading towards their illnesses. So there's people like Gabor Mate, who the MD, he wrote a book, When the Body Says No. Okay, and he talks about how different illnesses like MS, multiple sclerosis, or different autoimmune conditions, or cancers, or chronic infections, all have very similar histories, personality types, and relationships, right? And so those tend to create and manifest illness in those ways because the way those relationships are internally toxic stress or triggering childhood trauma or things like that, and then manifest in a physical disease. So again, these could be toxic work situations, a boss or a work environment, or maybe, bullying happens even as adults, or for kids, we know how bullying can affect their health. So personal relationships or dysfunctional families can be a big one. We know how those can create trauma, which it's true, they will create trauma. They can also create dysfunction in health. So maybe type 2 diabetes isn't really genetic for you, but it comes from a dysfunctional way of eating as a family that's going to create a setup for type 2 diabetes. So the ways we can look at this, again, case history. Okay, you're hearing me hit that over and over again. Get a really good case history. And this is not just a doctor's job, but patients, be willing to provide a good case history. Patient reporting, what are the patients telling you? Again, questionnaires, ACEs questionnaire will cover some of this, but you can use various questionnaires that can be helpful. Observations, pay attention. If there's a spouse in the room, how are they interacting? Or if the family's in the room, how are they interacting at that moment? Or even in yourself, pay attention. How do you feel after you interact at work? Do you feel better? Do you feel worse? This is really important on a healthcare standpoint to develop trust, rapport, and creating safety in the clinical environment. So people, number one, feel safe to report these things to you and create a healing environment, and that you can actually be a relationship for them that become nurturing. So, you've heard of the placebo effect and also the nocebo effect, where the doctor's attitudes and things they say can negatively affect the patient. So it's really important that the doctor-patient relationship be therapeutic on its own. Just having that relationship, building that rapport, that trust, that safety actually creates a therapeutic effect on the patient where it creates a healing effect for them. Okay, and lastly, let's look at the fourth environment. So this is the ITS, or the interobjective, or our physical environment. You kind of see I grew up in an era where Captain Planet was really popular, so I put him in the background there as our environmental superhero, if you will. So this includes the air we're breathing, the buildings we're in, EMF, mold, pollution, sunshine, the water sources we're drinking from. These can be positive and negative. How many trees do you have in your environment, creating an oxygen-rich environment? One thing that's really interesting about trees as well, especially in urban areas, is how much they change the heating and the moisture in the air, right? So if you're just living in a concrete jungle, that's going to be so much more heat radiating off that concrete and those trees and things like that. And it's going to change the humidity in the air. You add some trees and suddenly it gets cooler. Those trees start to pool some of that and create a more favorable environment for us. So this can go even deeper into things like sustainable agriculture, soil health. So again, pollution or other environmental factors, like I was talking about the trees. Okay, so it goes, and not just the practitioner having to understand where these patients' food sources coming from, but we can start to take an active part of this. We can start to support sustainable and renewable and regenerative agriculture. We can start to care about things like soil health, right? Are the farmers around us tilling or not? Are they spraying pesticides? So it's one thing for you to eat organic, but it's another thing for you to live in an environment, maybe you're in a rural environment where pesticides are sprayed on a regular basis. That can be a problem. So different pioneers, different doctors had pioneered the realm of environmental medicine. So they're looking at things like mold and pollution and toxicity that are affecting people. A little bit, this is what the, what's that movie, Aaron Brockovich about. This is a little bit about the idea, how is the environment impacting our health? But really, it becomes more than just healing ourselves. We want to look at the environment if we're chronically ill or we have an acute illness to heal ourselves, but we have to flip that, and it becomes about healing our planet, healing our environment. So we start to give back, start to become mutual again. So just like the therapeutic relationship goes back and forth, right? Then this relationship as well starts to come back and forth. We're looking at ways of healing ourselves, and then we're bringing that back into the environment to try to heal the environment again. And I want to thank the Mary Institute for their work in education and training other people in great agricultural resources, things that are sustainable and renewable, because that's what we need. We need to understand. We need to understand as consumers and people who are going out and buying and purchasing the food, or maybe we're having gardens, which is a great idea. What a great healing way to heal the soil, heal our environment, but also farmers. You know, I have farmers who are patients who farm traditional methods. You know, they till the ground and they monocrop, which means they use just one crop a year. So they're always planting corn or soybeans, which is really bad for the soil. Or maybe they're tilling, which just kills all those microorganisms in that soil. They don't know. That's just how they've done it for so many years. And then who are they educated by? They're educated by the seed manufacturers, by the pesticide companies. You know, they probably have a vested interest. They want you using the pesticides, right? They want you using the herbicides because that's how they make their money. And then who else doesn't know? Well, the banking institutions that lend their money to farmers. They're going to say to get the money, you have to follow the standard operation, right? Procedure. You got to use your pesticides. You need to till your ground. So it creates this dynamic. So we need to educate, which the Marion Institute is doing and other institutions are doing, in order to break some of those cycles. So again, we can heal ourselves through a positive environment, but we're also looking to heal others, right? We're looking to heal the planet at large. So how we assess that is, oh my gosh, look at that again. It's good case history, right? We want to understand, where are they from? Where is their background? You may want to do some mold testing in your home and work environment. Make sure you're not being exposed to toxic mold. You can do EMF testing, right? Tri-field meters, acoustic meters, Gaussometers that are measuring the load of EMF. In our clinic, we've done a really great job. We got to build it from the studs on out. And so we keep the EMF very, very low in the clinic. Everything's hardwired. We don't have Wi-Fi in here. We ask patients to leave their cell phones off so we can walk through and measure how low that is. We put extra insulation. We use the industrial insulation around our electrical wiring to keep that down and grounded as best as possible. So EMF testing is great. You want to test your water that's coming through your pipes. You want to test the city water if you're on city water. You want to test your well, right? There's some instances, I read a study recently where some Morgellons patients, it turns out they were getting exposed from their water heater. It was growing all sorts of algae and mold and fungus and bacteria that they were drinking. And it was actually manifesting Morgellons in those patients. And then you want to look for environmental toxicity using things like blood, urine, hair, stool samples, right? So we want to look for different environmental toxicities like heavy metals or pesticides or herbicides that we could be getting exposed to and don't know it. All right, let's go to the next slide. So I hit over and over again, I'm taking a good case history, right? So I want to take a moment to talk about that from both sides of the equation, as a patient and as a practitioner. So traditional homeopaths, doctors or practitioners who use homeopathy, they had to take a very detailed case history, right? They had to know every symptom you're dealing with, every background, all about your personality and your body type, because that's how they precisely picked out a remedy, right? They wanted to match you with a precise remedy. So sometimes they would take 2 and 3 hour long interviews, right, to understand this from the patient. So they were expert interviewers. So if you don't ever use homeopathy, that's fine with me. But I think it would be great to understand how to interview a patient, and the flip side of a patient, how to talk to the doctor so that they can get all these things to start doing some pattern recognition. So as a practitioner, a good case history, it might give you many facts that a blood test might miss, right? Especially if it's low-level things. So when you're starting to use these 4 quadrants, if you're what we call maybe integrally informed now, you're starting to look at some things through this 4-quadrant lens, you can start to ask questions about their environment, about their relationships and the culture they're in, the society they're in. You know, of course, you want to ask good questions about the physical body, but also about their mental, emotional, spiritual health, their background, right? We know from things like the ACEs study, the Adverse Childhood Experiences study, that what happened in their childhood impacts their immune system, so leads to more chronic infections, heart disease, metabolic syndrome, asthma, autoimmune disorders. So if you're not addressing those ACEs, that toxic stress from the childhood, you're going to have worse outcomes, or not as good or poor outcomes now in the current environment with those seemingly physical issues, right? So as a practitioner, you have to build trust. You have to listen. You have to identify patterns and key facts that are in the patient's story. Patients, I highly recommend you take a very detailed health timeline for yourself. Start what your mom can tell you about when you were in the womb. What was her marriage like? What was her relationship like? What was the environment like? Was she eating enough? Was she stressed about having another kiddo? Was she smoking? Maybe she was happy-go-lucky and that was great. You want to know all those things. Were you breastfed? Did you have any childhood illnesses? And you want to create this timeline for yourself, and then maybe you can see some patterns in yourself that you can point out. And then flip side is you can have something to give the practitioner that they can read through and understand. So I, for instance, had a patient who has some dizziness issues. We were just going over this week. And, she comes back, I realized as I was going back over these things that this happened, this started the exact same week out of nowhere that I got a flu shot, right? Decided to get a flu shot out of nowhere. Boom, this symptom starts coming. But you would never pinpoint that. You would never think to ever ask a question necessarily about that unless it was just on your mind. And so the patient going through a timeline now gives me something different to work on as a practitioner. So I would go through that from gestation and when you're in the womb all the way up till modern day. For the patients, I would create that timeline, right? Now, practitioners, you can ask about all that stuff in the room, but unless you are doing a 3-hour history, you're probably going to want to have the patient do some of that first because it'll streamline some things for you. And then you can ask questions about things in particular, and maybe you can cut it down. So in our clinic, we run more of like a 90-minute first day, and it allows us to streamline some of that. Let's look at the next slide. So now we're going to redefine, at least I redefine holistic medicine in our clinic here. So I redefine that more as seeing and treating the whole person through the view of all 4 quadrants, right? So now I'm trying to see their whole experience of life. And so all 4 quadrants, right? We had those 4 quadrants, the 1, 2, 3, 4. And you have to understand we can't separate those. This is not just a more extensive parts and pieces. It's still holistic. It's still the whole. So those are weaving in and out from each other. So our psychology influences and changes our neurology and vice versa, which then changes how we interact in our relationships and our culture and how we show up, which then changes our physical environment. If we're depressed, your physical environment may fall apart because you can't keep up with it. Or if your physical environment is a factor, it may be creating mold toxicity, which then creates inflammation, which then impacts your psychological health, right? You can't separate them. So if you have an illness or you're chronically ill, you're not doing well, even an injury, you break your leg, it's going to affect all of those, right? So if you're sick or chronically ill or injured, it's influencing all of them. And so the flip side, when we reverse that, we have to look at all of them when we're trying to apply a therapeutic or maybe a diagnostic setup in order to help the patient heal, right? So it's in and out. They weave in and out. One doesn't come before the other. They're all showing up at the same time, influencing, interacting with each other. So an example, okay? Many of my patients had childhood trauma, whether it was an abuse or neglect or abandonment or whatever, okay? We know through research that creates a poor immune function, but they probably manage, right? They might not be necessarily what we would call healthy, but they're functional to a certain degree. But because of that abuse, let's say, they have certain patterns that lead to them getting into a toxic marriage, okay? It may not be, they didn't get into this on purpose, but there's something in there that created this toxic setup. That creates a toxic stress. And now all it takes is a tick bite to put them over the edge, right? And they end up with Lyme disease. They end up with chronic infection or their mono, their EBV, that maybe wouldn't have been a big deal for the average person, suddenly becomes consistent, right? Creating chronic fatigue syndrome or what have you. And so when you look at that, you can address the Lyme, sure. But what we see in our clinic is that if you're not looking at these other things, you're not looking at the underlying immune function, if you're not looking at their toxic relationships, if you're not helping them deal with the emotional stressors that came back from it, then that's going to create consistent long-term issues. Maybe their Lyme's going to get reactivated constantly. Or instead of Lyme, instead of Borrelia infection, it's just going to be a Bartonella or EBV. It's going to be this, pulling out the rabbits and all sorts of tricks out of the magician's hat because you never took the hat off the magician. Right? You never said, hey, let's figure out why we're still holding this hat that keeps spewing all these infections out, right? And so I'm not saying that as a practitioner, as a patient, you have to expect your doctor to be everything, but you at least want to be informed. So you know, okay, maybe I'm going to deal with the structure and function of the body as a practitioner, and I'm going to help you find someone who can help you deal with a childhood trauma. I'm going to refer to someone who can help you deal with your toxic marriage, in this example, the toxic relationship. And so we're addressing all of those, and we're communicating together with the patient so we can create the best setup, the most holistic program, the most holistic healing environment for that patient. Let's go to the next slide. I hope that makes sense for everybody as I'm starting to shift from just this, and maybe some of it is not that the term holistic needs to change, but we need to look at it differently so that it's not so much just coming from I use some diet and supplements, or I look at the whole body, but we look at the whole person and their life experience through the 4 quadrants. So even if we're not, as practitioners or patients, you're not finding one practitioner who addresses them all, but at least you're informed enough to help find the patient get help they need, so we can now move to creating that holistic healing environment that addresses the whole life experience. Okay, I'll take any questions now we might have.
Dr. Hart, that was excellent. Thank you so much. And I would welcome that everyone on this call, please feel encouraged to ask any questions in the chat feature, and I'll go ahead and ask them. We actually have one offered a little bit earlier. Cosmology was mentioned. Have you considered the role of myth and the imagination in holistic healing?
This is one of my favorite topics, actually. I'm a really big fan of Joseph Campbell and the way he deals with what he calls the monomyth, right? And so he has a hero's journey where we go through and we get a call to action, and we're brought down into the, there's a whole bunch of steps here, but we're brought down to the underworld. Where in my mind, if we're using that myth, when we get dragged down into a chronic illness, we're getting dragged down into that underworld. But that means we're still the hero, the patient's still the hero. And so you can use some of those ideas of those different myths to both give you an idea of how to address some of that first quadrant, the psychological, emotional, memory components, but also it can help guide you through, as a practitioner, what phases the patient are in and what are they going through, or different variations of myths, especially like Carl Jung, or Jung as some people pronounce it. He was big on different myths, and so how those affect different illnesses and things like that, how we can think of that. And so to me as well, obviously I'm kind of passionate about this. I'm probably taking a long to answer this question, but symptoms and the symbolism of each symptom, I think, is important. If you're feeling all this shoulder pain and tension, is it possible you're feeling the weight of the world on your shoulders, or your world, your immediate world on your shoulders? Or it's interesting to me when patients get, in Chinese medicine, we call it plum pit qi, where we get a feeling of stuckness in the throat. Maybe you can't talk and it gets hoarse and cough and whatever. Or is there something you're choking on? You can't choke down, right? So we might call that mythological or symbolic. So is there something in your life you can't choke down, or that you didn't choke down in the past, right? And so that now is wanting to come out, or you're scared to say, whatever. So I think it's a fantastic way to view medicine through that realm of using myths and using symbolism. Yeah.
Yeah, excellent. I thoroughly enjoy the expansiveness of this conversation. I did have a technical question from Anne. Do you find in your practice, or through perhaps those are insurance companies covering holistic practitioners more frequently?
It does seem to be getting better in some areas. I practiced for a while in Oregon, so in some of those areas that are a little more progressive minded as far as alternative medicine and health and healing, holistic medicine goes, they were covering more of it. Acupuncture is more covered, chiropractic is more covered. There's different the insurance co-ops now that are covering like diet recommendations, nutritionists and supplements, and biological medicine is of course going to do very broad detoxification therapeutics, and they're starting to cover some of that. So it is getting better. Mm-hmm.
Wonderful. A great question from, I believe it's Raina. She says that Ayurveda also deals with the whole person versus the symptoms, working with the doshas and the elements in the body. They tend to use different methods like hair, nails, tongue analysis to understand the disease. What are some of the tools you use in your area of practice?
Yeah, Ayurvedic medicine is wonderful. It is another very holistic medicine in that approach. My background is a little more Chinese medicine. And so Ayurvedic's a whole other thing to study, but it is a great system. So the tools I will use physical exam from both a functional medicine standpoint, a Chinese medicine standpoint, a chiropractic standpoint. I'll use physical exams, so orthopedic, the whole 9 yards. We'll use standard lab testing. We use, which is big in the biological and bioregulatory world, computer regulated thermography. But then I'll also incorporate Chinese tongue diagnosis. I'll do some pulse testing. I'll do some kinesiological muscle testing for sure. Things like that, looking at things from a 5-element perspective. Yeah.
Okay. And I had a few questions come in before our call, so I want to honor those. One of those was from a woman who's 56 years of age, who has a family history of very high cholesterol. She feels she's avoiding high cholesterol foods and maintaining a healthy weight. She's asking if there are holistic treatments that are proven to reduce this type of overproduction. And I think we could probably expand on that a little bit, given the nature of our conversation, to say what else might be thought about in this context or overlooked in a common course of practice.
Yeah. So the big thing you said was cholesterol, right?
Yep.
Yeah. So for sure, one thing we notice is that when someone is in a constant environment of toxic stress, so if they're in a lot of personal stress in their relationships, in their life, maybe their work environment, their inflammatory status, their stress hormones, and their inflammatory markers are all going to go up, right? So if we're worried about high cholesterol, then affecting like heart disease, for instance, high cholesterol in of itself won't necessarily lead to heart disease. But when we start to get inflamed, that's when the body will stick cholesterol to those walls to try to help heal it, right? To help keep it from damaging the arteries. So that could be a factor, right? So, and what's really interesting is some of the different studies on like Italian populations or French populations who eat a really high fat diet or maybe do have high cholesterol, but they have really rich relationships and a social network. And they seem to live very long or have very low rates of heart disease. So we know there's a correlation there for sure. And then if we are looking at some more, maybe the physical environment, things like that, or the physical self in the body, there's great different supplementation, fish oil and berberine and different enzymes that can all help break that down, even if it is familial. You want to get your diet right. So always individualized. So I can't say necessarily, go eat paleo or low carb or vegetarian. It's more of what your body type and your kind of background is. So we use like some metabolic typing diet so you can understand, okay, I might do better. So personally, I do better on a little higher protein, a little higher fat, low carb, whereas somebody else might do better in a vegetarian diet for high cholesterol. Mm-hmm. So those are all major factors. And then environmental factors like mold, for instance, will strongly affect cholesterol ratio, your ability to process fatty acids. It'll affect your gallbladder. So if you have mold toxicity, you might have high cholesterol, or stressors on your liver, or stress in general, or inflammation of the body your body might create high cholesterol in order to deal with that. So we really want to ask, why do you have the high cholesterol, right? Because your body doesn't just, unless you have some just strange familial issue, even then I might not want to really lower your cholesterol, but some strange familial issue, genetic issue, there's a reason your body's producing. Your body is so intelligent, right? It was so beautifully made. It's so intelligent. It's doing that for a reason. And so we have to ask that question.
Mm-hmm. This is a really great explanation. And I love, I think we've been so preconditioned to ask questions about our health through a very narrow lens and, in a very mechanistic way. If we see this, we want to solve for it this way. And I think that it's maybe overwhelming, but also really hopeful to consider all the various dimensions that factor into our health and really highlight the importance of that case history. I do have a few similar questions, so I'll ask them, and I love the way that you just broke down that last question, so hopefully you can add some insight here. I've got Allison who's asking for any recommendations, especially with regard to nutrition or supplementation for neurodegenerative disease involving gastroparesis. Do you have any thoughts on that?
Yeah, so my thought first would be, and she may know this, but I don't at the moment, so I'll just talk both ways around it. Is the neurodegeneration causing the gastroparesis, or did the gastroparesis lead to neurodegeneration? But either way, gastroparesis is where the stomach doesn't empty fast enough. Maybe the muscles don't contract well, so stuff just sits in there. And so we have to look at that a little differently, because they maybe can't take a lot of supplements and things like that. But one option would be we just need to nourish the brain. With neurodegeneration, we need to nourish and protect the brain. And so some great options from that front might be just coconut oil or MCT oil, because it'll be easy on the digestive tract. It's easy to get down. Our brain can use it right away. It doesn't take a lot to absorb into our digestive system. So that's a really great option. And it's an easy option on that front. And then something that's very neuroprotective would be, I pronounce it copaiba oil, or I've heard it pronounced copaiba, right? And so that is very anti-inflammatory, very neuroprotective. It's very well tolerated orally. So it could be taken with the coconut oil, or it could be used or aromatically, or even sometimes I'll have patients dab a little inside the nose for that route. So that's starting to help protect the brain. But again, you want to look at, okay, what's driving the gastroparesis? So on those two, what I've seen with some of my cases is that maybe they have a infection that infects the nervous system, right? They have some sort of a chronic infection. Maybe there's an EBV that likes the nerves, or maybe there's a Lyme disease that's gone neurological, right? And it's affecting those. Or they have some sort of an autonomic dysfunction, which is throwing off the vagus nerve, which is leading to the gastroparesis, and they can't absorb their B12, so now it's leading to neurodegeneration, right? So we have to look at what the cause is and what's driving it. And then, like we said, from the 4 quadrants, start unraveling it so we can get to the root.
Yeah. I'm gonna look over the chat box, and I have a few just kind of general questions too that I want to broaden our conversation with. But staying with this theme of kind of looking at some of these different types of health experiences, Anne had asked if there are any suggestions you might have for women going through menopause, dietary or other.
Yeah, so going through menopause, so basically for women, that's where they stop relying. I was going to say we, but I don't have any ovaries. They stop relying on their ovaries for hormone production because they're no longer going to be menstruating and producing eggs, or at least releasing eggs. Now the adrenal glands are going to be the primary hormone production. So the number one thing for menopausal or perimenopausal women is to make sure your adrenal health is on point. So make sure you're supporting good sleep structure. You're doing good stress management, right? So we can keep those adrenal glands nice and healthy. I would recommend keeping your blood sugar nice and steady, right? We don't want massive fluctuations because that stresses the adrenal glands. The adrenal glands need lots of vitamin C. They're a good storehouse for things like natural sodium, like Himalayan or Celtic sea salt. Those are all things that can be very helpful for our adrenal glands. And then so if I had a patient who is dealing with that and I'm trying to support her body and dealing with those issues, number one, I'm going to look at that. And then as we start to get that balanced out, I might look at the rest of the hormones. Does she need a little bit of estrogen support in the way of maybe some like black cohosh or something like that, or some phytoestrogens? Does she need a little progesterone support or some way of all natural bioidentical progesterone, or some testosterone support or things like that? So we can start to tease that out individually. But first, I'm starting from the front of how can I support the adrenal glands?
Yeah, excellent. All right, so I do want to back us out. I'll watch the chat box for additional questions, but just thinking a little bit on a broader scale and getting some perspective from your role, Dr. Hart, I'm curious to know that, from your perspective, what are some of the most concerning trends when it comes to health that are collective in nature? So, what is the impact that kind of some of our collective concerns are having on patient health these days from your perspective?
Yeah, so I think from a collective perspective, a big thing right now is stress and fear, right? How much stress and fear and dependence on outside authorities do we create? And so I think that's a huge health trend, although it is starting to buck back. I think good education at places like the Marion Institute and good practitioners and functional medicine and things like that are starting to produce a great pushback on some of that. But we spent so long collectively pushing our health authority outside of this wonderful body, right? So we think every time something is wrong, what do I need to take? Do I need to go get an antibiotic? Do I need to go get a Tylenol? Do I need to whatever? And realizing the body is doing some amazing things. So how can I just support the body instead of trying to necessarily do something to make it change? But instead, how can I support the body in doing what it's already done? It's so wonderful. It's already doing all these great things. It has all these anti-inflammatory mechanisms, all these antimicrobial, all these great ways to protect myself. Like, well, how can I support that? How can I love and nurture that? Is a big one. So the fear and the abdication of authority and things like that are a big one collectively. And I think other elements, so if we kind of look at all the quadrants, you could look at things like health trends as far as agriculture and the foods that creates, GMOs and pesticides. That's creating a lot of health issues. Like we already know that different versions of Roundup are creating cancer and create mass amounts of leaky gut and create brain inflammation. So, okay, we know that's a factor. So we need to address that collectively, right? We need to start to push back on that front. Or all the junk food. I was listening to a great book on ACEs a little while back. And this doctor who developed a clinic, and she noticed that in her neighborhood where this clinic was at, they literally had no options nearby for fresh fruits and vegetables. There wasn't a grocery store close by that really sold much. There's no restaurant close by that wasn't your typical fast food joint. The best she had, they said, was a sub sandwich place, and that was the closest. So those are collective issues that we can address. And so to me, as we start to address those things, what are we eating? What are we putting into our body? What are we allowing to be done in our environment? How many cell phone towers are we allowing, right? What's the stress and the message we're allowing ourselves to listen to and hear and bring in? And how's that affecting us? I think those are the big collective issues.
Mm-hmm. Excellent. Another question, kind of staying out in this wider realm, it just, again, but we also informed by your practical experience, which quadrant, if there's one, would you say is among the most difficult to address when it comes to patient health?
Yeah, from my perspective, I would say, if you're addressing quadrant 1, the hardest thing is the patient, making sure you don't make the patient feel like they're just crazy, right? Because that's how many patients have gone to the ER and they've just been told it's all in their head or whatever, right? So if you're addressing quadrant 1, letting them know it's not about them being crazy or all in their head. It's about addressing an aspect of their health. But that's not usually the hardest. I would say the hardest is either helping a patient address a relationship issue. Number one, for my issue, is I have zero power to do anything, right? I'm powerless to help you on that front. That's a step you have to take, right? I can't make you change your work environment. I can't make you change your relationships, right? I can give you resources. I can point you in the right direction, but ultimately that's up to you. So I would say that's number one. And then number two would maybe be the physical environment, just because that's so stressful. Sometimes I have to tell patients, I think you need to move out of your home. Your home is so moldy. I don't know that we're going to be able to remediate it. You'll be able to remediate it in a way that is going to allow you to heal. And I'm so sorry, but I do, as your practitioner, think that that's probably a massive factor and that you probably should move out. That's stressful. That's hard. And sometimes patients don't want to do it and they refuse and they still want you to try to help heal them. But, that's an impediment. You have to help convince them. But I would say that's a second, is helping them deal with their physical environment.
Yeah. And it is fascinating. I know you hit on EMFs earlier, and there's all these new technologies, and certainly probably not enough data to fully comprehend how they'll impact our health going forward. So I think just vigilance and some awareness that these things factor is quite significant. I'm wondering if you could share with me any examples of patients whose outcomes have been improved by taking a holistic approach, as you've described it.
Yeah. So not too long ago, I had a long-term patient over a few years who she rang what we call our well bell, when the patients is either significantly better, made significant improvement, if they want to ring the well bell. And she did. She went from debilitated, couldn't work since she was in high school, had to drop out of high school, spent most of the time in bed with a lot of neurological symptoms, seizure-like episodes, fatigue, POTS type symptoms. I mean, the whole feet turning purple and swelling and, lots of broad symptoms, to now she's working full time, helping to run her family farm. And she's in university. And so some of the things we had to do, of course, were physical, right? We had to address the physical realm. But for her, she had two significant factors, okay? And I think this is a big one for chronically ill patients. When you get ill in your adolescence, you miss out on a lot of those developmental milestones that should give you the courage and confidence to go out and start to tackle the world. So by the time I saw her, she was in her 20s, which means she had missed all that. So as she was starting to get physically way better, we were running into this mental milestone of she's basically learning how to be an adult without any practice. Your teen years are really practice for being an adult, okay? You're practicing independence. And so we had to work on some of those emotional blocks. That was number one. And number two, she's an international patient. So she came from a culture that really wants you to stay in your box, right? They come from a culture where you get basically, I don't want to say punished, but you get called out for standing up too high, for being too much outside of the norm, outside of the box. And so she really had to overcome some of that cultural conditioning, that familial conditioning that we had to work on in order for her to fully embrace her wellness. And so we had to hit really hard that first quadrant and that third quadrant. And we worked on all four of them. We did. We had to work on mold in her physical environment. We worked on all the internal physical things, but we really had to get those two, the cultural issues and the emotional, mental issues balanced out so that she could fully embrace being well and healing.
Yeah, that's really exceptional. I know I'm seeing that, Carmen has contributed some in the chat box. She's talking a bit about EMFs and concerns, and I know she's not alone. A lot of people have concern over EMFs and the proliferation of these towers that are going out with, increasingly greater capacity and range. You kind of spoke about it a little bit just in terms of the way that the Biologix Center was built out, but for those who are perhaps more sensitive to EMFs and who share that fear of how that could be affecting systems, do you have any advice or guidance you might offer on it just in a practical way that might be addressed in everyday life?
Yeah, I think first is, before the call, you and I were talking a little bit about Stoicism. And in Stoicism, one of the main principles is this idea there's some things you can control and there's some things you can't. And the way to freedom for them is to say is we got to focus on only things we can control, right? So with the EMF issue, we have to understand there's only so many things we can control, right? I can create some community awareness. I can petition the city council, but to some degree, I can't change where they're going to put a cell phone tower, at least not directly. And so I have to understand what I can control, what I can't. So if we're only going to focus on what we can control, then I think things that are very helpful, practical steps is if you can turn your Wi-Fi in your home off at night, that's going to be huge. Even to some degree, if you can turn your whole circuit breaker off at night, that's going to be helpful. It's going to really lower the EMF load. I recommend you do get some of those meters that I talked about so you can figure out, are there some factors in your home that are just really high that are unusual, right? Maybe you have a poorly wired outlet that needs to be rewired. Ungrounded outlets are a big cause of toxic and what we call dirty electricity, right? So I had one patient and her husband was a contractor and him and I talked extensively about this to the point where he became like green certified. It was really great. And so we talked about how to figure out his home because his wife was so EMF sensitive. Well, and she could only make dinner. She didn't make dinner in 5-minute spurts because she'd go stand up and cook and chop and she'd get a massive migraine, have to sit down until it kind of calmed down and do it again. Turns out right at her head height, because she's a little bit shorter, were some electrical outlets. So one like on this side and one on this side of the kitchen counter, right? They were ungrounded. So when he was using the tri-field meter that I had him pick up, it turned out she was having this strong electrical field, EMF field that was right at her brain level. As soon as he grounded those outlets, wow, she cooked dinner, no problem, no migraines. Okay, so you want to ground those outlets. Those are going to be key. And then, there's different protective devices that are helpful. You could hardwire your home, which is helpful. There's different grounding paints. There's different protective clothing and things like that. Those help to varying degrees. So that's all good. Getting your heavy metals balanced out internally is huge. That's a big factor. We do know that EMFs strongly affect your glutamate and antioxidant pathways in the body. So having plenty of antioxidants, plenty of magnesium, that all helps balance some of the EMF. So there's some practical tips.
Yeah, and I think too, I'm just reading again through some of her comments, it sounds like there's a lot going on with some co-infections and things. And I don't know that, this is the second time we've had you here. So I would love to just provide an opening too for you to talk a little bit about Biologix and, your areas of specialty, if you would do so, I think just for those who maybe don't know as much about your center there outside of Nashville. Yeah,
so the Biologix Center, we are a clinic that we specialize in complex chronic illnesses. So we specialize in the things that other practitioners maybe haven't figured out yet. They've been hanging around and lingering around for a while. So some of those things that come to us are things like Lyme disease, autoimmune conditions, things that are kind of mysterious that haven't been figured out yet, mold toxicity. We see a lot of histamine intolerance and mast cell type patients. So when they come, our goal is to restore their optimum health, right, with the Biologix Center for Optimum Health by focusing on supporting the structure and function of the body. And then we do take, of course, after I have all presented on it, a 4-quadrant kind of integral approach as best as we can. So some things we aren't relationship counselors, so we'll refer patients out for those sort of things. But then in the clinic, we're going to take our philosophy is really biological and bioregulatory medicine, right? That's our philosophical approach. So we're looking at the way the biology of the body should function. And then we're looking at what's causing distortions in that and then helping to restore that optimum function. And so when patients come in, they're going to see one of the 3+ doctors on staff. They'll get time with them every day that they're here. They're going to be doing various therapeutics and various therapies in the rest of the clinic that support detoxification. They support things like neurofeedback and neurological balance. We're going to be doing things like different modicums of physiological therapeutics and physical therapy, lymphatic drainage, light and sound-based therapies, frequency-based therapeutics, things like that to really support the medicine. So patients might see me for up to an hour a day, for instance, and in the room we might work on, so for one day I might work on their structure of their spine, I might work on supporting their immune system and detoxification, and then they'll spend anywhere from 3 to 6 hours in the rest of the clinic doing those other therapies. And they'll come the next day, I'll get to see how they responded to the treatment, adjust, and keep making progress that way. So we've done our best to really do an all-encompassing, all-inclusive protocol. So we do function, our patients come typically for 1, 2, more severe cases, maybe 3 weeks. They'll stay in accommodations nearby the clinic, which in beautiful Nashville, beautiful Franklin, Tennessee, it's wonderful weather, wonderful scenery around. We're blessed to have lots of great things to go do if they feel well enough or the family feels well enough. Wonderful, healthy food very nearby, local organic options. And then while they're here, they're getting supported in every facet we can do, very individualized, very frequency-based. And then one thing we're very excited about is a new innovation that we just submitted for peer-reviewed research article on, peer-reviewed review on, is our induced native phage therapy, which is a new therapeutic that deals with phages, which are types of viruses that are already in bacteria and things like that that control the bacteria. So the therapy will help to influence those phages to eliminate the bacteria. And that's what our review research is on that we're working on getting published right now.
That's exciting. And I know you just kind of glossed over, but just to highlight it, correct me if I'm wrong, it's quite typical that your patients do stay for a week, 2 weeks at a time, correct?
Yeah, so we start patients at a minimum of 1 week. That gives us enough time to really address the issue in full, start to do some of the therapeutics. You know, typically what we've seen is we'll get patients referred in from practitioners or things that it just wasn't enough where they were at before, right? So we really want to help them get over that edge. We want to create a tipping point of health and healing. And so seeing them for at least a week, ideally 2 weeks if they can. Severe cases maybe a little more, but typically 1 to 2 weeks, so we can really create that momentum they need to trigger that healing situation.
And just, I think you mentioned it as we were speaking before this call, but I think you said 80 to 90% of your patients are coming from outside the state or country even?
Yeah, so 80+% up to 90% are out of state, out of country. So you very often, there's some patients I have right now who are from South Carolina and Connecticut, and I've got Texas, and I've got Georgia, and I've got some locals in. So it's not uncommon for also be some Canadian patients or French patients, things like that, who are coming in. Australian. Right now, Australia's locked down, but we have a decent amount of Australian patients that come in because really we are very blessed to be a clinic that has a great founder and great inspiration that allows us to develop treatments and strategies that help cases that nobody else has helped. And so we do get patients from all over the place that we can really focus on them and getting them where they need to be.
Great. And I know there's a question here. It'll probably be the last question and we'll wrap up. And in a minute here, I'm going to post the link for our next BioBites. December, we will be looking at structural energetic therapy with the founder of that that therapy, which is Don McCann. I'll post the link here momentarily, but I know there was a question about whether people can come and learn, practitioners can come and learn at the Biologix Center.
Yeah, so we're working on some realms with that at the moment, but right now we don't have any structured practitioner role. I'll do a little plug if you don't mind. We are looking for one more practitioner. So if you're interested in learning and potentially working with our clinic, please send an email in. I'd love to chat with you. But otherwise, right now we don't have a structured learning environment, although I'd love to hear more about yours. I know we chatted about that a little bit. You guys seem to have a great biological medicine program going on. So yeah.
Yeah, and I'll take a moment to speak about that because it's been a long time coming. But we just launched this past October a biomed for practitioners course series. Is taught in 3 parts. The first is live streamed on Zoom, and over 2 days. You can basically get your introduction to the foundations of biological medicine. Parts 2 and 3 are in person at the Biomed Center in Providence, Rhode Island. And part 2 focuses on learning diagnostic technologies and how to use those effectively to develop a care plan. And part 3 is all around therapeutic care and explores hands-on technologies available, as well as additional forms of therapy to assist in patient health. And it does have a very large emphasis on the business side of health too, to help support the development of strong teams to support patient care. So that's our plug. If anyone on this call is interested, I'm happy to chat about that. But on that note, I see we're coming up on time. I did include a link for next month's BioBites in the chat, and I would love to see you all there. I am deeply appreciative for those of you on this call for joining us at 1 p.m. today. And Dr. Hart, I'm certainly thankful for your time. It's a pleasure as always.
You're doing it. Thank you. And thank you everybody for listening.
Yeah, have a great day all. Bye now.